Okay, so this is our anterior side of the heart. This is the posterior side. So on our anterior side, the right auricle is right here. The left auricle is right here. Anterior side, the anterior interventricular sulcus is this, and on posterior side, this. Next we have the right atrium and the right ventricle. So if you open it up, right atrium is relatively up here, it's covered by muscle, and our right ventricle is here. And left atrium is up here, and our left ventricle is here. Then we have the interventricular septum, and the septum is this right here, just the muscle going down the middle. That's it.
So from the right atrium, we go inside to the tricuspid valve, which is going to be this side, and then also through to the right ventricle, which is going to be lower up here because the atrium is higher up. And then from the right ventricle, we have the pulmonary semilunar valve, which then goes to the pulmonary arteries, which are relatively going to be up here. And then from there, we have the pulmonary arteries that go through to the lungs. And then from the lungs, it comes back through to the pulmonary veins. So right here we have the myocardium, which is all of this muscle tissue on the inside. And then the endocardium is going to be this really thin layer right alongside the myocardium. And then all of these small vessels right here are going to be the chordinae tendineae. Then we have the aorta up here, and the three branches of the aorta include the common carotid, the subclavian, and the brachiocephalic. And then from there we have the papillary muscles, which are going to be on the inside, and they're going to be all of these thicker branches, not to be confused with chordinae tendineae, which are a lot thinner. And then from there we have the pulmonary arteries, which are going to be they're going to be up here somewhere along the pulmonary trunk. And then from there we're going to have the pulmonary veins, which are going to relatively be around here. So some of these smaller vessels. And then the superior and inferior vena cava is going to be this vessel up here. This is going to be superior, which then leads down here to the inferior vena cava.
On the right side is a tricuspid valve, and it's right here. And the bicuspid is up here, relatively. From the pulmonary veins, we go to the left atrium, and from the left atrium, it follows to the bicuspid valve, and from the bicuspid valve, it goes to the left ventricle. From the left ventricle, it heads back up towards the aorta and goes to the aortic semilunar valve. Once it gets to the aorta, it goes out to the body.